Sepsis is a lengthy topic. Let's learn what we need to know to specialize in coding for the conditions. In the last video, we asked you to relax on sofa. Can't wait to learn what is sofa. Let's do it. Sepsis definition. Sepsis is life-threatening organ dysfunction from a dysregulated response to infection. Do you know about Q-SOFA score? SOFA stands for Sequential Organ Failure Assessment Score. The Q-SOFA score identifies patients with suspected infection at greater risk outside the ICU. 3 criteria, 1 point each. Systolic blood pressure, 100 mmHg, respiratory rate, 22 per minute, and Glasgow Coma Scale 15. A score RKT2 suggests greater risk. SOFA score assesses pulmonary, hepatobiliary, cardiovascular, neurological, and renal systems. Let's discuss querying sepsis. Learn the do's and don'ts. Official coding guidelines can be confusing. Let's learn which guidelines to follow and when to query. Always follow the sepsis guideline requiring cause and effect documentation. When it comes to severe sepsis guidelines, query and assign codes for organ dysfunctions. Sepsis due to post-procedural infection guidelines must query always if there is a documentation of sepsis and post-procedural infection identified in the record. Guideline IC1D5.A, sepsis due to post-procedural infection states, code assignment is based on the provider's documentation. Querying on similar terms for sepsis. Urosepsis. Do not assign any code for urosepsis always. Clarify meaning, it can be sepsis versus UTI versus other. If you look at the ICD-10 index, septicemia codes to A41.9, sepsis also codes to A41.9. Let's understand this with a clinical scenario. Clinical indicators documented on a patient were febrile, heart rate 126, blood pressure 150/80, lactic acid 2.3, bilirubin 1.5, PF ratio of 194. Admitted for acute respiratory failure, found to have a vegetation on her ICD lead and positive for Enterococcus faecalis. Started on antibiotics, gradual stabilization of hemodynamic, and return to baseline oxygen requirement. Underwent transesophageal echocardiography and implantable cardioverter defibrillator removal on May 14th. TEE concerning for possible AV valve vegetation. Bacteremia due to Enterococcus. Started ampicillin on May 10th. Continue ceftriaxone. TE showed large mass attached to the ICD lead in the right atrium. Repeat blood cultures drawn daily until negative. No growth to date. Clinical query. Patient admitted with bacteremia due to Enterococcus with vegetation on her ICD lead. Clinical indicators: bilirubin 1.5, PF ratio 194. Treatment: ampicillin, ceftriaxone IV PB, 4 liters oxygen nasal cannula. Given this scenario, we can query the physician. Based on your medical judgment, please specify the diagnosis monitored, evaluated, assessed, and/or treated this admission. And the possible options you may give the physician to select are bacteremia without sepsis, simple sepsis, severe sepsis, sepsis causing acute respiratory failure, other, unable to determine. How do we code for sepsis with organ dysfunction not linked? Scenario 1, sepsis and acute respiratory failure with hypoxia. Code A41.9 and J96.01. Scenario 2, sepsis and acute respiratory failure due to sepsis. Our codes change here to A41.9, J96.01, R65.20. With just the linkage between the conditions, the DRG elevated to severe sepsis rather than a sepsis, this will be coded to the DRG 871 and APR DRG of 720. The severity of illness score is 3 and risk of mortality score is also 3. Thank you for joining us in this deep dive into querying concepts of sepsis. We hope this video has provided you with a clear understanding of accurately coding and documenting sepsis cases. Accurate coding is crucial for patient care and effective healthcare management. If you found this video helpful, please give it a thumbs up and share it. Don't forget to subscribe for more educational content. Hit the notification bell so you never miss an update. Thank you for watching, and keep coding with confidence.